Cording can be a stubborn side effect after breast cancer surgery, and this video covers what you can do about it. This is a two-part series on cording. If you haven't watched the first video, which covers in detail what cording is, that's a good place to start. I had cording after my double mastectomy, and I tried everything in terms of treatment and self-care to address it. This video details what worked the best, and I know these things will help you too. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. The goal of reducing cording is to not only improve the visible signs of cording, but also, and more importantly, is to improve your shoulder motion and function. When can you start these strategies? Most of them you can begin after the 6-week mark after your surgery. The best approach to treating any stubborn condition like cording is to do it with multiple modalities. So basically coming at it from all angles. A consistent effort greatly pays off over time with cording. This isn't a condition where you can do stretches for a few weeks and then you're good to go. What type of treatment is best to do? This video covers many strategies to address cording. It can be a bit overwhelming to know where to start. I would pick 1 or 2 things to start out with and go from there to see how you're progressing. Don't think you need to do all of these at once. I've actually continued to do many of these strategies for maintenance for my cording. I've made a ton of progress and have near full range of motion in my shoulder, but I'd like to reduce the tension that I feel on the cording side as compared to the other side. Some of these strategies you can do yourself and some are done by a therapist. I'll start with the ones that you can do on your own. The first is early and continued range of motion of the shoulder. The natural reaction to the pain and tension with cording after surgery is to avoid moving your arm and shoulder, which then just leads to even more tension in those areas. The 2 movements to focus on initially after surgery are shoulder raises to the front and to the side. These are generally a part of the first stage of rehab exercises given after surgery. I focused on early range of motion after surgery, and I think this is one of the reasons why my cording wasn't as visible in those first few weeks, even though I could still feel some of the tension. Some surgeons are particular about not raising your arm above a certain angle for 2-ish weeks after surgery, so check with your surgeon on what they recommend for your case. In order to see improvement with cording, you want to consistently move your shoulder to its outer ranges at least a few times per week. If you don't use it, you lose it. And if you're not taking your shoulder through its full ranges of motion, which includes up overhead, then you're not fully tensioning the cord. Doing consistent exercise was really helpful with cording, and especially movements with my arms overhead. I first started this unweighted and then added weights. If your shoulder motion is quite limited, you want to stick with doing it unweighted first and work on that range of motion before adding weights. Your mode of exercise doesn't need to be doing weights like me. Swimming, especially front and back crawl, can be just as helpful. You want to try to really sort of extend out when your arm is overhead while you're doing those strokes. If you're not doing weights or swimming, then there's a specific shoulder exercise that will help to put tension on the cord called a pass-through. You can do this with a broomstick at home. Place your hands in a really wide position on the broomstick. Move the stick up and over your head so it ends up behind you. Then repeat the pass-through in the other direction to bring it back to the front. You can do a few repetitions of this movement and try to keep your arms straight throughout. You'll likely feel a pull or a stretch somewhere along the chest or down the inner arm. When that motion gets easier, move your hands in about 1 inch or 2 on the broomstick. Then repeat another few times, doing the pass-through to the front and to the back. And then continue to move your hands closer together until you're not able to do the pass-through with straight arms. Stretching is another strategy to put tension on the cords and the surrounding tissues. The first stretch is snow angels, and this one's more of a dynamic stretch. Start by lying on your back with your arms by your side and palms facing up. Move your arms away from your side in an arc and go up as high as you can. Be mindful of keeping your arms straight throughout. You can go back and forth about 5 to 10 repetitions. You're likely to feel this stretch in the similar places to the previous one. Once this starts getting easier, you can progress this stretch onto a foam roller. The next one is a sideline pec stretch. Lie on your side with your affected arm straight out in front of you. Move your arm as far back as you can and hold there about a minute. Doing deep belly breaths throughout this time will allow these tissues to relax more. You can also do this stretch with a bent arm, which stretches the cord in a bit of a different way. Bar hanging is the last stretch. I saw a lot of improvement when I added bar hanging into my program. This is definitely more of an advanced strategy, and I'm going to do a separate video detailing all of the different steps. But for this video, you can start with a variation where you'd keep your feet on the ground. To start, you can grab onto a bar or something overhead and lean your body weight down. An alternative, if you don't have a bar, would be to hold on to a staircase railing or another object in front, or you can use a counter at the kitchen sink. You would grab on and lean back to sink your body weight down and hold this position. For any of these variations, you would work your way up to accumulating 90 seconds in as few sets as possible. So this could be doing 9 sets of 10 seconds, or it could be doing 3 sets of 30 seconds. The next strategy is nerve flossing, also known as nerve glides. Nerve flossing allows you to put a stretch on the nerve tissue, not just the muscles. You can start by placing your arm in a stretched out position to the side. Next, you're going to extend your wrist so your fingers are pointing back. Then alternate this movement with flexing the wrist so your fingers point forward. Be sure to keep your arms straight throughout this exercise to keep full tension on the cord. Continue to alternate these movements back and forth 10 to 15 times, and you could do this twice a day. If your cording is extra stubborn, then these next 2 variations can help. For the first variation, you can repeat that same movement with your hand back and forth, but this time you're going to add neck movement. Each time your fingers point back, you can tilt your head away. Then when your fingers are pointing to the front, you can tilt your head back towards that arm. Continue to alternate these movements about 10 to 15 repetitions. The second variation is starting out with a static chest stretch against the wall. Keep your arms straight with your fingers pointing back so your wrist will be in an extended position. You may already feel a stretch in this position, and you can hold that about 30 seconds to a minute. If you don't feel enough of a stretch, then you can slightly turn your body away from the wall and then hold that position. The last progression is to add neck movement. You're going to tilt your head away from your arm as your wrist is still extended. You then hold this position just like the last one. Adding the head tilt helps to put more neural tension on the cord. You don't need to do all these variations. You can try them out and then pick the one that you find the most useful. The fourth strategy is self-massage of the cord. You can rest your hand or arm on a chair if you're doing this sitting. Start out with general circles along the cord as there's likely tension in the surrounding tissues and fascia. You can do this the length of the cord. Then using your fingers or thumb, you can massage back and forth over the cord. So you'll be going perpendicular to the cord. Do this massage a few times in each location and then move along the cord to the next section. I typically start in my underarm area where the lymph nodes were removed and then work my way down my upper arm and then lower arm. Then I'll start in the same underarm area and go in the other direction into the side of the breast. Depending on how long your cording extends, you can continue from there. I had cording that went into the breast and then actually down the front of my torso, so I ended up doing this massage down the whole front of the torso as well. It's important to be quite firm with your pressure in order to see results. Massaging the cord would take a few minutes, and it really depends on how far your cord extends on either end. Consistency is more important, so you're better off doing a few minutes a day compared to once a week for 20 minutes. The fifth strategy is scar massage. This can be done at 6 to 8 weeks after surgery once your incisions are fully healed. cording from that armpit area can often be connected or linked up with your breast scar. So if you trace that area from the underarm to the side of your breast, you'll often feel more tension in that area. This is important to do whether you had a lumpectomy or a mastectomy. With a lumpectomy, you'll have that separate incision in the underarm area where your lymph nodes were removed, and you'll have your breast scar. So the cording may actually be connected to one or both of those areas. With a mastectomy, if your scar was right through the center of your breast, then the cording is often linked with the outer edge of that mastectomy scar. And then same thing goes if you had a mastectomy scar under the breast fold, then it's usually that outer region that the cording connects to. I won't go through the entire scar massage protocol in this video, as I covered that in a separate one in detail. But for the purposes of this video, you want to ensure that you're not only massaging the cording from the underarm area to the breast, but your actual breast scar as well. One example is using a circular pattern with your 2 fingers or your thumb. You can start at one end of the scar and do this circular pattern in one section, and then move along to the next area. So you would do the entire scar just section by section. Because everything in the body is connected, if you're releasing the tension in the scar, that can help to release some of the tension at the upper end of the cord. This one isn't a huge time commitment to see benefit, just a couple minutes a day. The next strategy is treatment or manual therapy. In general, you're likely to see some significant improvements in cording symptoms when you add in treatment. You can expect even more improvement when you're combining treatment with the self-care strategies that I previously talked about. Hands-on or manual therapy helps to release the tension in the cords. It also helps to reduce tension in some of the surrounding structures to the cords that the cords may actually be adhered to. And this can further contribute to reduced range of motion of the shoulder. The therapist would work the entire length of the cord, and like I said, they're also going to work on some of the surrounding structures. So this may be your breast area, chest, neck, shoulder, mid-back, and even side of the torso. You ideally want to see someone who has experience with breast cancer patients. If you don't know anyone specifically, your hospital may have a resource list of practitioners in the community. Sometimes you'll actually hear pops or snaps when the cord is released during treatment. It's been speculated that the supporting tissue that surrounds the cords is breaking and not actually the cord itself. In any case, it's usually viewed as a good sign if you hear these noises, although it does not happen in all cases. When it does, the pops are usually followed by a significant improvement in the shoulder motion and also a decrease in the tension in the cords. I didn't have any pops or snaps when I got treated, but I did respond quite well to manual treatment of the cords. The last strategy is cupping. Cupping was another strategy that really helped with cording symptoms. To contrast this, manual therapy or hands-on therapy uses more of a compressive force on the tissues, and cupping does the opposite. It pulls and suctions. So there's a release in tension with cupping, and it helps to release the cords from some of the surrounding structures that it can really be adhered to, things like muscles and fascia. Cupping can either be done statically, where you would have a cup in one location and you would leave it there, and then you'll see those circular type bruises afterwards. It can also be done more dynamically, where the cups are moved along the arm, and this is more typical for cording. There's many different types of cups. Some are made of silicone, some are plastic, and some are glass. Cups can also have a different mechanism in order to produce a suction. So some have a plunger on them, and that's usually used more by a practitioner because it's a little bit easier to use with 2 hands. Or if you're doing it yourself, sometimes the cups that have the silicone ball on the end are a little bit easier with 1 hand. The cups are generally moved along the length of the cord back and forth. Then it's repositioned on a different section of the cord, and again move back and forth in this new section. I found the cupping with the plunger worked the best for me when it was done by a practitioner. When the cups are suctioned more, it's definitely more of an aggressive treatment, but I also prefer deeper treatments. Deeper does not necessarily mean better, as everyone responds to different sort of pressures of treatment. If your pain tolerance isn't as high, your practitioner would simply apply less suction to the cups. Can you do cupping on your own? You sure can. When I did this, I got the glass cupping set with the silicone balls on the end, and I did find this a little bit easier to do on my own, even though I have the other set with the plunger. The set I have, which I'll link in the description below, comes in 4 different sizes. So I would typically use the larger type size on my upper arm, and then usually a smaller size on my forearm, and then for the cording that goes from my underarm area into the side of the breast. You can start by placing the cup anywhere along the length of the cord. Squeeze the ball of the cup so that it suctions the tissue, and then move the cup along the cord back and forth. You don't need to do the entire length of the cord in one swoop. You can do smaller sections back and forth a few times and then move on to the next area and work on that section. It's obviously much easier for a practitioner to do this on you, but just try to cover as much of the cord as you can. I find a larger cup works better in general, but if there isn't enough tissue for the cup to suction, then you'll need to size down. Be sure to hit that subscribe button down below, as it'll help other women with cording find this information. I hope some of these strategies will help you. Remember, you don't need to do all of these at once. So pick 1 or 2, try them out and see your progress, and then you can decide how many more you need to add in. Let me know in the comments below how long your cording lasted, and also what were the things that helped you the most to address it. See you in the next video.